Hello guys, today we are discuss about epilepsy. Welcome to my YouTube channel, and we are today discuss epilepsy. So what is epilepsy and what are the causes and how can we treat it? So first of all, what is epilepsy? Epilepsy is a continuous is a seizure. Means epilepsy is what? First we have to understand epilepsy, and then first we have to understand seizure and then epilepsy. So what is seizure? Seizure is an clinical event caused by abnormal electrical discharge in the brain, while epilepsy is the tendency to have recurrent seizure. Okay, these are two terms we have to firstly understand it. So seizure is a paroxysmal event due to the abnormal excessive hypersynchronized discharge from aggregate of central nervous system. Epilepsy refers to a clinical phenomenon rather than a single disease entity. So epilepsy is not a contagious, it is not a mental illness or a cognitive disability. The neurological dysfunction seen in epilepsy can begin at birth, childhood, adolescent, even in adulthood. Causes of seizure. So neonate less than 1 month. Perinatal hypoxia and ischemia are the causes. Intracranial hemorrhage, acute CNS infection, metabolic disturbances, developmental disorder, genetic disorder. In infant and children, febrile seizure and genetic disorder. Adolescent trauma, it can be seizure can be occur due to trauma, brain tumor, illicit drug user, or idiopathic. Idiopathic means we cannot know the reason behind it. In young adult, trauma, alcohol withdrawal, and older adult, cerebrovascular disease, Alzheimer disease, and hepatic failure. Classification of seizure: partial seizure. So a simple partial is a consciousness is fully preserved during the seizure. Means that consciousness is present. And seizure is termed as a simple partial seizure. Complex partial if consciousness is impaired. Means consciousness is impaired in this seizure. So and the symptomatology is more complex than it termed as complex partial seizure. Partial seizure with secondary generalization if seizure that begin at the partial and spread diffusely throughout the cortex and termed as a partial seizure and secondary generalization. Causes of seizure. Causes of partial seizure. Genetic. It may be genetic. Tuberous sclerosis, neurofibromatosis, cerebral migration abnormalities. Dysembryogenic cortical dysgenesis, cerebrovascular disease, intracerebral hemorrhage, arteriovenous malformation, and cerebral infarction. Tumor, inflammatory, sarcoidosis, and vasculitis. What is pathophysiology behind epilepsy? In normal circumstances, recurrent and collateral inhibitor circuits in the cerebral cortex limit synchronous discharge of a neighboring group of neurons. The inhibitory transmitter gamma is important in this role, and drugs that block GABA receptor provoke seizure. Excessive stimulation by excitatory neurotransmitter such as acetylglutamate and aspartate provoke seizure activity. It is likely that both reduction and inhibition and excitation play a part in the genesis of the most seizure. So generalized seizure. Generalized seizure arises from the both cerebral hemisphere simultaneously. Absence of seizure, petit mal. Absence of seizure are characterized by the sudden brief lapse of consciousness without loss of postural control. Tonic cloning, grand mal. They are the most common seizure type resulting from the metabolic derangement. Tonic, sustained muscle stiffening, tonic phase, fall to the ground, respiration are interrupted, back arches last about 1 minute. Clonic, sustained muscle contraction alternating with relaxation. Cloning phase, rapid muscle jerking, we are seeing these images, muscle flaccidity, tongue biting, heavy salivation. Atonic seizure are characterized by the sudden loss of postural tone lasting 1 to 2 seconds. Myoclonus is a sudden and brief muscle contraction that may involve one part of the body or entire body without loss of consciousness. Here are the investigations. Investigations are EEG, CT, MRI, serum electrolyte, blood glucose, liver function test, serum calcium, serum magnesium, CBC, urine, ESR, CSF examination. These are the causes and investigations are the of the epilepsy disease. Okay, thank you. If you like my videos, please like, share and subscribe it.